It is estimated that about 6 out of every 100 people will suffer from post-traumatic stress disorder at some point in their lives. PTSD Awareness Month is here to spread the word that everyone with PTSD, whether they be veterans or civilian survivors that have experienced trauma, can get help. And there are treatments out there that can lead to a better quality of life. Joining us with more on this topic, we have Dr. Sonya Norman. Thank you for joining us. So tell me, what is PTSD and how does someone know if they have it?
Yeah, PTSD is post-traumatic stress disorder, and it's something that some people develop after a life-threatening traumatic event, like living through an assault or combat or a disaster. And some of the symptoms are having a hard time not thinking about the trauma, maybe through nightmares or just during the day, trying to avoid thinking about it a lot. Changes in how you feel, like maybe more guilt, more anger, feeling easily startled and jumpy all the time. And a lot of people feel this way right after a traumatic event. But if someone feels this way for more than 30 days and these symptoms are severe, that might be PTSD.
And why is it important for people to take a self-screening test for PTSD to see if they have it?
A self-screener is a great first step because, first of all, it's really quick and easy. The one on our National Center for PTSD website is 6 yes or no questions. It takes a minute. And it can just give someone an idea of, I've been feeling awful. I'm always down. I never want to go out and do things I used to enjoy. I have nightmares. I can't concentrate. Why am I having all these problems? And the screener can start giving someone an indication of, wait, this might all be related. It might be because of that trauma. It might be PTSD. And the best thing about it is once you know it's PTSD, there's treatments that work really well. It's a game changer. So the screener won't give you a diagnosis, but it'll suggest maybe this is PTSD, and then you can take it to your doctor, to your mental health provider. If you're a veteran, take it to who you see at the VA, and they can really do a more thorough assessment to figure out if it's PTSD or something else. Make sure you get into the right treatment, help make those referrals, and that screener kicks it all off.
And you touched on something that I was just about to ask. If someone is likely to have PTSD based off of that screening, what's their next step?
Yeah, the next step is to take that to a healthcare professional, whoever you see, whether it's a doctor, a mental health professional. Tell them, hey, I had this screen. I want to talk to you about how I'm feeling. I want to see if this might be PTSD. They'll help you figure out if that's what it is, and they can help you get to the right care.
And what can you tell us about the most effective PTSD treatments available?
So the key is that we have effective treatments. We can treat PTSD. People can feel a lot better. And the key is to get one of those effective treatments. And those include specific psychotherapies that we call trauma-focused therapies and certain medications. The trauma-focused therapies, what ties them together is that they help someone process the trauma, those memories, those feelings they still have, and helps them move forward from that. The 3 that have had the most evidence behind them, the most research, that are most likely to be available in your community are prolonged exposure therapy, cognitive processing therapy, or EMDR, eye movement desensitization and reprocessing. I would look for one of those. And on the medication side, medications that work well for depression tend to also work well for PTSD.
This is such an important topic and conversation. If listeners and viewers want to keep it going, where can they get more information?
Yeah, so a great place to start is that screen that I mentioned. It's at PTSD.va.gov/screen. It's at 6 questions, yes or no, great starting point. That also takes you to our National Center for PTSD website, which has so much about PTSD, about treatment options, about other things people might experience after trauma. It just kind of opens up that whole, all that information.